to Uganda, where the country has declared the end of an Ebola outbreak. According to the World Health Organization, an outbreak of the disease ends when there have been no new cases for 42 consecutive days, twice the incubation period of Ebola. Uganda's health ministry had said that if no new cases reported by Tuesday, it would formally announce the end of the outbreak on Wednesday. The declaration ceremony is taking place in the central district of Mubende, which has been the epicenter of the latest outbreak. At least 56 people have died of the disease since the first case of this outbreak was reported in September last year. Well, let's cross over to Isabel Nakiria in Kampala. Isabel, so what's the latest on the announcement that Uganda is now Ebola-free?
Yes, Beatrice, as you rightly put it, the ceremony has taken place in Mubende, which was the epicenter of the disease and where the outbreak started from. The Minister of Health, Dr. Jane Ruth Acheng, has just declared an end to the Ebola outbreak, which claimed 56 lives and over 140 cases confirmed. We saw that there was some form of excitement in that district because, as you know, the district was put under lockdown for several weeks and everything came to a standstill, business came to a standstill. And so the residents were excited to have a declaration to an end to that outbreak and lives going back to normal again. The WHO was there. It commended the country for responding to the outbreak very fast. As you know, it's 4 months since that outbreak was declared, and it commended Uganda for good work done for bringing that outbreak to an end in such a little time compared to the West African countries that had outbreaks going on and on for several months. But one thing that the Minister of Health said was that people still need to be vigilant and report any new or suspicious cases because you never know, anything can crop up. And so the health systems are still standing by to respond to any new cases just in case.
Well, Isabel, you know, the outbreak has sadly caused the deaths of over 50 people. The country is, however, being praised for its handling of the outbreak of the Sudan Ebola strain that did not have any vaccines. What is coming out of the vaccine clinical trials that are currently underway?
Uganda received 5,200 doses of the vaccines, which were supposed to be used for the study on the Ebola Sudan strain. But as you may know, the study was supposed to be done on contacts of people who have come in touch with people who are already sick. But there are no new cases in the country at the moment. So scientists need to come back down to the table and remodel the design of this study and find out if they can carry on a new research, a new study without cases. But for the time being, those vaccines are under cold chain. But the Minister of Health did confirm that they are just not there to be stored. Any new cases can crop up anywhere in the world and of this particular strain, and these vaccines can also be used in that country, as it has been done in other countries where, you know, cases crop up and, you know, vaccines are taken to be used there as, you know, as a study. So for now, those vaccines are in cold chain, but they are not there just to be stored. They are there for any kind of emergencies. But scientists are working round the clock to do a remodeling of the design for that particular Ebola Sudan strain.